Next, I want to talk about our partnership with All Stripes. I'm going to break this into two sections because it's really important. The first section is what is it and how can it help? And the second section is where do we currently stand with All Stripes? So we've partnered with All Stripes because we believe it could significantly transform how patients and families can help the research process. All Stripes makes it easy for participants to access all of their own medical records while contributing their de-identified information to help advance new treatment research, all from home, all at no cost. And I'll talk more about how this could benefit research in just a second. So how does it work? First, currently, it is only available for patients and families in the USA, the UK, and Canada. The company is working on expanding it to other countries. So basically, you sign up, you create an account, you review the consents, and you share as many health facilities, hospitals, and doctors that you can remember that your child with Sanfilippo has been to. Then the All Stripes team does all the work behind the scenes to retrieve and process all the records. They'll then be uploaded, including maybe, doctor's notes that you may never have even seen before. You'll have access to all of these at any time, and then the team de-identifies the records, and they begin structuring the data and the information and combining it with other Sanfilippo records so that various analyses can be done that helps the research process. So again, exactly how could having all these medical records together help the research process? Well, we've talked about how the FDA usually likes to see these natural history studies for nearly every clinical trial that's created so they can compare a treatment effect against a baseline. And as a reminder, a natural history study is just various tests and procedures like cognitive evaluations, blood draws, looking for certain things, and they basically track patients over time, patients that are not being given any treatment. And let's just say 12 months of time for a certain set of patients, let's say 20 patients. Well, the biotechs use this information to show disease progression with no treatment so that the FDA can then look at children with treatment and say, are they following this same path as Sanfilippo, or are the kids on treatment doing better? Are they diverging from this? The challenge is that in these natural history studies, these are only for the patients who are part of this study and who are able to come into the centers to be evaluated. What about the thousands and thousands of research records for Sanfilippo children that are out there but are just lost to the world of medical records? That's where this tool and this service can be incredibly beneficial. And also, the natural history studies only focus on the tests and procedures that the company at the time thinks are worth measuring to reach conclusions about their treatment. And while that's good, it certainly leaves out a lot of other data points that could be useful and important. A real-world hypothetical would be, let's say the FDA is considering granting accelerated approval to a treatment for Sanfilippo, but needs some real-world endpoints to measure. And let's say it's decided that hearing is one of those endpoints that they want to look at. Well, not every natural history study done previously might have looked into something like hearing. And we don't want to have to do another 12-month or more study on children with no treatment just to look at hearing and evaluate hearing and monitor hearing. This information exists already, and it exists in these medical records. So what if we had hundreds of medical records of children with Sanfilippo? We know for certain there would be lots of data for hearing appointments, ENT doctors, audiologist visits, hearing aids, and this would not be for a specific point in time, but it would be over the course of the disease progression for this child. This might be a perfect endpoint to see if treatment is helping. Another example is swallowing, swallow studies, and when is there need for a feeding tube. So having all this data available in All Stripes allows us to see truly what is happening in the medical history of children with Sanfilippo, with the hopes of strategically using this information as a comparison for the FDA to see treatment benefit in the hopes of reaching an approved and available treatment for children. And I should say, this is not just for children living today with Sanfilippo, but also for the angel children who have passed away. It's another way that the legacy of your child can continue to give back to helping find treatments or a cure. And records of angel children actually are particularly helpful because it allows researchers to see the whole picture of medical records throughout the entire journey. And the second part I wanted to talk about was, where do we stand with All Stripes? Well, our goal is to have 130 individual Sanfilippo patient records entered in All Stripes, and currently we have 52. And the numbers are broken down into subcategory by Sanfilippo type based on prevalence. And if we can reach these numbers, this 130, we feel we'll have enough quantity to have enough quality data and representation of each type of Sanfilippo. So the breakdown is as follows. For type A, we have 23 entered, and our goal is to reach 70. For type B, we have 14 entered, and our goal is to reach 40. For type C, we have 15 entered, and the goal was 10, so we achieved the goal there, and so great job to the type C folks. And they can still always enter additional information even after we've reached the goal, so more data does not hurt. And for the rarest type of Sanfilippo, we have 0, and the goal is 10. So Sanfilippo D is very, very rare. It might be difficult to achieve. So please, any Sanfilippo parents listening or watching, please reach out to us with questions about All Stripes. We hope you will consider participating, again, at no cost. We would be happy to discuss with you and even put you in touch with All Stripes. This is so important, and it could be the difference maker in moving approved treatments forward. We hope to reach this goal of having 130 children's medical records in All Stripes by the spring of 2022. So now is a great time to start. Again, please contact us or visit allstripes.com/Sanfilippo.